So a very good morning, good afternoon, good evening, whatever time you're watching this video at. But obviously not a good night because we cannot go to bed just yet. We have a bone to study, a cranial bone that needs understanding. Very simple to understand. It is one of the simpler cranial bones, just like the mandible was. So today we start on, or rather study, about the parietal bone. So obviously, this structure needs no introductions. This is the human skull, obviously. And so, um, the very first thing that we will be doing here is locating the parietal bone. So let's first identify and locate it. Yes, this is the parietal bone. This is the parietal bone, but this is our parietal bone. Why? Because parietal bones are paired bones. So this is the right parietal bone and this is the left parietal bone. So here we face the first problem in cranial anatomy, that is side determination. Yes, this problem we did not face when we were talking about the mandible as such, because the mandible is an unpaired bone. But the problem that we face here is, which sided parietal bone are we talking about? Is it the left one or is it the right one? Well, side determination is obviously important, but for determining the sides of the parietal bones, we first need to understand a little bit about the anatomy. So this is how the parietal bone is placed, right? All right, we will come back to this view when we will be studying about the different articulations of the parietal bones, the different borders of the parietal bones, the different angles of the parietal bones, and how they are all articulated with the different other cranial bones. We will come back to this view. But for now, let's study the parietal bone, or rather the right parietal bone, individually, right? All right. So the very first impression that we have when we start studying the parietal bone is that this looks like a quadrilateral plate. Yes, it's a very beautifully geometrical bone. There are many cranial bones which are very irregular. Most of the cranial bones are irregular. But as far as the parietal bones are concerned, they are very, as I have said, symmetrical. Not symmetrical, but their shape is quite geometric, if you may. That is quadrilateral, four-sided. All right? Right. So the very first thing that we will be doing is obviously describing the different aspects, the different anatomical aspects of the parietal bone. And for that, we need a little closer inspection. Look. What view of the parietal bone are we seeing here? This is the posterior view. Yes. So, all right, do me a favor, all right? Whenever we will be talking about the parietal bone now, throughout this entire discussion, try to visualize about how this bone is actually placed in the skull. For example, now that I'm holding the bone, or rather showing the bone in the anterior view, quickly visualize how it would have looked in the skull. This is very important. So this is how it would have looked in the anterior view. See, I was showing this view. This is the parietal bone. This is the anterior view of the parietal bone. We are viewing it from the anterior side. So in the lateral side, this is how the parietal bone looks. It is quadrilateral, and obviously it has this outer aspect, or rather the outer surface, which is smooth and convex. Yes, so let me again isolate it. Right, so this is the parietal bone. Now, this right here is the convex outer part of the parietal bone. All right, it is convex and it's quite self-explanatory. Whereas this is the inner concave side of the parietal bone. Again, pretty explanatory, right? Now, what about the borders of the parietal bone? Yes, of course, it has borders. As I have said, it is quadrilateral, so it is bounded by 4 borders. Now, listen very carefully. This here, let me show you. See, this here is a posterior border. All right. This here is a superior border. This is the anterior border, and this is the inferior border. Should I slow down? This is the anterior border, this is the posterior border, this is the superior border, and this is the inferior border. But the thing is not only about describing it, I have to explain how I came to know about which border I'm talking about and how I am sure about if this is the inferior border or this is the anterior border. How am I sure about it? Listen to me. This is going to come in handy when we are talking about side determination of the parietal bone. So we are kind of doubling up here. So what we are doing here is looking for any uniqueness in the borders. We can all make out that these are all borders, right? This is the first border, this is the second border, this is the third border, this is the fourth border. But what we are looking for anatomically is a uniqueness. And the very first uniqueness that we find is notched here. This border is notched, see? So it is unique. That is why we have to remember that the inferior border of the parietal bone is notched. All right? It is not a straight line, it is a notched one. If we come to know about what the inferior side is, we can obviously make out this is the outer surface and this is the inner surface because of the convexity differences. And now we know that this is the inferior border. How do I come to know that this is the anterior border or this is the anterior border? That is also a bit tricky, right? For that, listen to me. Do you see this prolonged angle here? This is an angle. See, the parietal bone is quadrilateral, right? But it is also quadrangular. It not only has 4 sides, it also has 4 angles, just like a rectangle would have, just like any quadrilateral would have, right? So it is quadrangular as well. So along with the 4 sides, it also has 4 angles. The first angle, the second angle, the third angle, the fourth angle, right? This angle here, you see, again, this is unique. Why? Because it is prolonged. It is prolonged. No other angle is prolonged as that angle. And now we remember as a memory aid that the prolonged angle is in fact the antero-inferior angle. The antero-inferior angle. So if this is the antero-inferior angle and this is the inferior side of the parietal bone, this must be the anterior side, so that the angle between the anterior side and the inferior side is the antero-inferior angle and it is prolonged. So now we know that this is anterior, this is inferior, this must be posterior, and the upper one must be superior, right? So in this way, we can conclude not only on the sides, but also on which one is which border. This is the anterior, inferior, posterior, and the superior borders. As far as the angle is concerned, just like I have described here, this is a unique angle here. That is the meeting point between the anterior border and the inferior border. That is the antero-inferior angle. Whereas the other angles are this over here which is the meeting point of inferior border and the posterior border. So what will this be? The postero-inferior angle, right? Whereas this angle here is the meeting point between the superior and the posterior borders. So it is the postero-superior angle, and the other remaining one, let me get you a better view. This is the other remaining angle. This is the junction between the anterior and the superior. So the antero-superior angle, right? See, the antero-superior angle is kind of 90 degrees, right? It is kind of a right angle. So that is also kind of a unique thing. Although it is not very distinguishable, here it is quite distinguishable that it is a 90 degree, but I would still go for the prolonged antero-inferior angle to determine which border is which. All right, but it does not hurt to know that this is a 90 degrees, almost 90 degrees. Which one? The antero-superior angle. So having talked about the angles, we are not obviously done with them. We still have to know about the articulations and such. But let's go again in a systematic order, and let's first describe the surfaces of the parietal bone. All right. Now, this obviously is the outer convex smooth surface, right? Now, I want to draw your attention to a very particular spot on this outer convex surface of the parietal bone. See, this here is the posterior view of the parietal bone, right? Now, this convexity, there is a point on the parietal bone where this convexity is the maximum, right? Maximum. That point on the individual parietal bones, which is not very visible here, you will still have to make it out. It is not like it is demarcated or anything like that. We have to make it out by seeing it. That is the point on the parietal bone where the convexity is the maximum. That point of the parietal bone is known as the parietal tuber. So let me show you the parietal tubers on both the parietal bones. So this is kind of the postero-superior view of the skull. These are the posterior borders of the parietal bones, the two parietal bones here. This is the occipital bone. We are not talking about it right now. What I want to draw your attention towards is the parietal tuber on both the parietal bone. So it is kind of here, right? The parietal tubers on both the parietal bones can be kind of appreciated when we see it from the posterior view, which is somewhat over here. And for the other parietal bone, this is somewhat over here. Now, the parietal tubers, as I have told you, they are the points on the parietal bones where their convexity is the maximum. But there is more importance to those parietal tubers. What is the importance of the parietal tuber? Let me tell you. You see, in the skull, the maximum transverse diameter is the interparietal diameter. Let me repeat it again. When you join the two parietal tubers of the two subsequent parietal bones, we get the maximum transverse diameter of the entire human skull. So that is something which is very important, and hence parietal tuber is an important landmark of the parietal bone, right? And the parietal tuber can be well appreciated from the postero-superior view of the parietal bones. because the parietal tuber itself is located kind of posterior superiorly. All right, all right. There is another importance of the parietal tuber. What is that importance? That importance is that the parietal tuber is the point of starting of ossification of the parietal bone. Let me repeat it again. The parietal bone is a membranous bone. That is, it ossifies in membrane, right? So it must start from somewhere. The ossification, it must start from somewhere. Where does it start from? It starts from this parietal tuber. Okay. So that is why the parietal tuber is very important. Now, having dealt with the parietal tuber, let's move on to some more important landmarks. Very clearly, we can see two lines here. Can you see it? I hope you do. So, these two lines that are visible over here on the right parietal bone, these are what we call to be the temporal lines. Yes, the temporal lines. Now, this temporal line, it is occurring in a pair. That is, there is a superior temporal line somewhat over here, clearly demarcated, and an inferior temporal line here. Both the superior and inferior temporal lines, they kind of run parallel to each other. So the superior temporal line is running like this on the outer convex body of the parietal bone, and the inferior one is also running parallel to it. Obviously, these two temporal lines, they are not only limited to the parietal bone, they move on to the frontal bone as well, and other cranial bones as well. We will be dealing with them when we will be dealing with the individual cranial bones. Those other cranial bones, I mean. But for now, let's get on with the temporal lines as far as they're concerned with the parietal bone. Now, the superior temporal line, which is quite visible over here, this serves as an attachment. It serves as a point of attachment. To what exactly? It serves as a point of attachment to the temporal fascia. The temporal fascia. And the epicranial aponeurosis or the gallia aponeurotica. All of these we will study when we will be studying about the scalp. But for now, since we are dealing with the osteology, so let's not dwell beyond our scope here, and let's move on to the inferior temporal line. So the superior temporal line, it provided attachment to, please repeat, yes, the temporal fascia and epicranial aponeurosis. The epicranial aponeurosis is kind of extensive. The temporal fascia is also attached to the superior temporal line, right? But what about the inferior temporal line? The inferior temporal line, which runs parallel to the superior temporal line, that actually is providing attachment to the temporalis muscle. The temporalis muscle. All right. When we were talking about the mandible, this is just a very quick revision. When we were talking about the mandible, I had talked about a part of the mandible which, when pronounced, which when uttered, you should immediately refer to the temporalis muscle. What was that structure? Yes, it was the coronoid process of the ramus of the mandible. The anterior coronoid process of the ramus of the mandible, right? So anyways, the inferior temporal line, it is providing attachment to the temporalis muscle, and it is also actually binding the temporal fossa. The temporal fossa is a hollow space along the the temples of the human body. It's a hollow space, and the inferior temporal line is actually the upper demarcation of the temporal fossa, right? So that is why these two lines, that is the superior and inferior temporal lines, they are pretty important, and we can clearly visualize them in this model of the parietal bone. Now let's move on to the next landmark. We are studying about the outer surface of the parietal bone, and we have already talked about the temporal lines over here and the parietal tuber. Now we are moving on to this. Can you visualize this? Yes, it's pretty visible over here. This foramen, this hole, this is what we call to be the parietal foramen. The parietal foramen. So this parietal foramen, this is present along the midline, on either side of the midline, on the surface of the parietal bone. And what the importance of this parietal foramen is that it allows the passage of some structures. I have told this many times before, and I'm telling this for the umpteenth time now, that almost all foramina in the cranial bones, they are present for a purpose, and that purpose is to allow the passage of some structures, that is, some vessels or some nerves. So this parietal foramen is also no exception to that. So what are the structures that pass through this parietal foramen? Yes, it is the emissary vein, the emissary veins, and occasionally an artery also passes through this parietal foramen, which is the meningeal branch of occipital artery. Meningeal branch of occipital artery. I hope things are not getting too overwhelming, because parietal bone is not really related to that many nerves or vessels as the other cranial bones will be, or even as the mandible was. So this is perhaps only the few structures that is related to the parietal bone. So kindly do me a favor and do remember these names. That is emissary veins. Emissary veins is not a particular vein in such. They are connecting veins. They are veins which connect. What do they connect? They actually connect the blood supply above the skull, or rather out of the skull, to the blood supply inner to the skull. So the emissary veins are actually connecting the veins of the skull itself and inside the superior sagittal sinus, which we will be talking about just in a moment. So this is the parietal foramen. It allows the passage of the emissary veins, and what did I say? Yes, the meningeal branch of the occipital artery, right? So it is quite demarcated over here, right? So now, by the way, what view are we currently engaged in? What view is this? Yes, this is the posterior view. So we are seeing the parietal bone from the posterior side. So this is the superior border, this is the posterior border. Remember what I had told at the beginning of the video? Yes, please kindly do continue visualizing how the parietal bone is placed. When I keep rotating the parietal bone, what happens is that many times you may get confused as to what border is what, and what surface is there, or which aspect I'm talking about the parietal bone, or which view we are seeing the parietal bone in. So that should not be the case. See, this is the anterior view here, the anterior border here. This here is the inferior border. This here is the posterior, this is the superior. If I'm repeating things, it obviously means it is important. Okay. So now that we have kind of talked about the surface, the outer surface of the parietal bone, we are free to talk about what lies inner to the parietal bone, right? The inner aspect or the inner surface of the parietal bone, it is not convex, it is rather concave. And the very first thing that we view, or rather notice, when we talk about the inner aspect of the parietal bone is these vascular markings. See? I hope it's visible. See? It's quite demarcated. So these are all vascular markings. These impressions, they are present due to the underlying blood vessels. Okay. Apart from these vascular markings, we also have irregularities on the surface of the parietal bone, which is kind of visible over here. You can appreciate the irregularities in the inner aspect of the parietal bone, kind of, right? These are present, or rather these kind of become imprinted upon the inner surface of the parietal bone due to the gyri of the parietal lobe of the brain, because obviously the parietal bone, it is overlying the parietal lobe of the brain. So obviously that must have gyri, a lot of gyri. That creates those surface irregularities in the inner aspect of the parietal bone. Whereas these distinct lines that we can appreciate, they are due to the vascular markings. That is, they are due to the impressions of the blood vessels. But since we're talking about the parietal bone here, right? These vascular markings, we can conclude that these vascular markings belong to the middle meningeal vessels. Very, very important. See, what I was talking about. These vascular markings, they are present due to the underlying blood vessels. But since we are talking about the parietal bone specifically, and the vascular markings present on the parietal bone itself, we can say that this part of the brain is supplied by the middle meningeal vessels. So the vascular markings are also due to the middle meningeal vessels. That is, the middle meningeal artery and the middle meningeal vein. Mostly the middle meningeal vein is responsible for the vascular markings. Now let's talk about these markings in a teeny tiny little bit more detail. You see, as I've already demarcated here, this is one set of marking and this is another set of marking. They are not connected to each other, right? See, which side of the parietal bone is this? Yes, this is the posterior side. If ever you get confused, just remember that this is the antero-inferior angle, right? See how prolonged this angle is? So this is the antero-inferior angle and this is the inferior border, see, notched, right? So obviously this is the anterior side and this is the posterior side. Now, what we see is that the vascular markings which are located closer to this anterior side, the anterior angle, these vascular markings, they are produced due to the anterior division of the middle meningeal vessels. Whereas the set of vascular markings which is closer to the posterior side, the posterior angle, these are produced due to the posterior division of the middle meningeal vessels. All right. So what I have said, I'm repeating again. There are two sets of vascular markings found on the inner aspect of the parietal bone. These vascular markings, which occur in two sets, the one which occurs closer to the anterior part, this is produced due to the anterior division of the middle meningeal vessels, whereas the one which is closer to the posterior side, this one is produced due to the posterior division of the middle meningeal vessels. Much more contribution is due to the middle meningeal vein more than the artery. All right, so is one correlation done. Now let's talk about another vascular structure. So this is the inner aspect of the parietal bone, right? This here is the superior border. So can you visualize how we are seeing the parietal bone? Kindly do not get confused. Please keep your head straight. This is the superior border. I'm telling that this is the superior border, right? Right. Whereas this here is the anterior border. And this here is the inner aspect of the parietal bone. Now, what I would like to show you guys is another vascular relation of the parietal bone, or rather the inner side of the parietal bone. That is, if you look closely enough, it is not very visible here in this model, but here in relation to this superior border, there is a faint groove, right? It runs along the superior border on the inner aspect of the parietal bone. A faint groove runs, right? When the corresponding parietal bone will join with the other parietal bone, then this part will be completed, right? Let me show you that. So this is the articulated parietal bone. This is the two parietal bones articulated. This is obviously the inner aspect of the parietal bones, right? And see, what I was talking about is this is the superior border, and we are obviously seeing the parietal bones from the inner aspect. Now listen very closely. You see, I had talked about a faint groove on either side of the superior border on the inner aspect of the parietal bone running along the superior border of the parietal bone. These two faint grooves together, they will form what we call to be the sagittal sulcus. The sagittal sulcus. And that will actually lodge the superior sagittal sinus. So along the midline, the superior sagittal sinus will run, and along the midline we find these two grooves on either side which form the sagittal sulcus that will lodge the superior sagittal sinus. Now let's get on with the other vascular relation. So we talked about these lines which were related to the middle meningeal vessels, right? We talked about the superior sagittal sulcus or the sagittal sulcus which lodges the superior sagittal sinus. Now there is just one more remaining. See, which angle is this? If this is the prolonged angle, that is the antero-inferior angle, and this is the inferior border, this is the posterior border, so this is the postero-inferior angle, right? Now the posterior-inferior angle is an important angle. Why? This is because you see the inner surface of the postero-inferior angle is not very clearly given here, but the inner surface of the postero-inferior angle that lodges the sigmoid sinus. So for lodging the sigmoid sinus along the postero-inferior angle, which is this, there has to be a groove present, right? So there is a groove present over here, which is not very visible along the inner aspect of the postero-inferior angle of the parietal bone, and that groove lodges, what did I say? A sigmoid sinus. All right. So we talked about the superior sagittal sinus, right? Along over here. Now we talked about the sigmoid sinus, which is along the postero-inferior angle of the parietal bone. Let's talk about the articulation of the parietal bone now, in correlation to its borders and angles, right? All right. So the first border that we will be talking about here is the superior border. This is the superior border. Now, the superior border is the longest border of the parietal bone. This is something that I want all of you to appreciate, that it is the longest border of the parietal bone. Now, we need to understand how it is articulated. See, this is the superior border of both the parietal bones. So, this is the articulation between the two parietal bones, right? Here, this is the anterior border of the parietal bone. We will be talking about it in a short while. But what I would like all of you to appreciate is that this meeting point between what we can call to be the frontal bone here and the two parietal bones along their superior border, this meeting point is what we call to be bregma. All right. So the superior border, it is joining the two parietal bones together, and this superior border, it is actually articulating along this angle over here, which is the anterosuperior angle of the parietal bone, with the frontal bone in the front over here, right? So this is the frontal bone, and this meeting point of these bones over here, very clearly demarcated, is the bregma. Now let's move on to the posterior aspect. All right. See, the superior border here also, it forms a meeting point with the occipital bone. Yes. So the superior border over here, it comes and joins with what we can call to be the squamous part of the occipital bone, or rather the anterolateral borders of the occipital bone. See, this is the occipital bone, and this here is the anterolateral borders of the occipital bone. And obviously over here, this will be the posterior border of the parietal bone. So the meeting point of the parietal bones and this occipital bone over here, along there you see superior border and the anterolateral borders of the occipital bone, this forms another point of intersection, if you may, called lambda. So at the anterior aspect, we found bregma over here. And now we have lambda. Both are related to the superior border of the parietal bone. And the superior border of the parietal bone is also the longest border of the parietal bone. Now let's move on to the inferior border. The inferior border is very interesting because it has a lot of articulations. What are they? See, this over here is the inferior border up to this. So this over here, this is a prolonged antero-inferior angle. So along the antero-inferior angle, the inferior border of the parietal bone, as you can see, it is actually connected or rather articulated to this bone, right? See, this is the inferior border, right? The inferior border along its antero-inferior angle over here, it is articulating with this bone. What is this bone? This bone is the sphenoid. See, this is the sphenoid bone. But we need a little bit more precision than that. So what part of the sphenoid bone is this? This is the greater wing of the sphenoid. All right. So if I do a quick little, we are not going to study sphenoid here, obviously, but this is the part which we were being able to see from the lateral view. This over here, this is the tip of the greater wing of the sphenoid. This is the greater wing of the sphenoid. These are the lesser wings, but we are not concerned about them. So this greater wing, as you can see, this is also the part of the greater wing. This is the tip of the greater wing, right? So the tip of the greater wing of the sphenoid, that is actually articulating with the inferior border of the parietal bone along the antero-inferior angle. Now, if we proceed posteriorly, the middle part of the inferior border, this is actually connected to this bone over here. This over here, this is the temporal bone. So we had the sphenoid anteriorly. At the tip, we had the sphenoid. Then in the middle part, we have temporal bone. But we need a little bit more precision than that again. So the middle part of the inferior border of the parietal bone is actually articulated with the squamous part of the temporal bone. See, let me get this straight for you. At the very beginning, it is located or rather related to the sphenoid. At the rest of the border, it is actually related to this temporal bone. But there is a twist here. The twist is that temporal bone has two parts, at least from the lateral view. The anterior part is the squamous, that is this part. Whereas over here, this is the what we call to be the mastoid part. The mastoid part of the temporal bone. So the middle part of the inferior border of the parietal bone is articulated to the squamous part of the temporal bone, whereas the extreme posterior part of the inferior border of the parietal bone is articulated with the temporal bone. But which part of the temporal bone? Yes, the mastoid part of the temporal bone. So anteriorly the squamous part, posteriorly the mastoid part. And at the very anteriorly, greater wing, or rather tip of greater wing of the sphenoid, right? So that is why it's a quite extensive articulation of the inferior border. So we talked about here the superior border related to the frontal bone, that is the bregma, the occipital bone along the lambda, and we talked about the inferior border. Now let's quickly get on with the anterior and posterior borders. See, the anterior border is over here, and obviously we can see that the bone which is in articulation with the anterior border is what? Yes, the frontal bone, or the squamous part of the frontal bone, if you are to be a little bit more precise, because the frontal bone also has a nasal part. But anyways, so the anterior border, as we can see from both sides, it is meeting the superior border, and the frontal bone is also articulated, and their meeting point is the bregma. Obviously, I've told this a number of times before. So that is the anterior border. Now, how about the posterior border? The posterior border is obviously this one, and this is linked, or rather articulated, to the anterolateral borders of the occipital bone, as I have already said before, right? So these are the anterolateral borders of the occipital bone, and they are articulating along with the superior border. They are forming the lambda, which is the meeting point of these bones over here. Now, let me draw your attention for one more time over here. We talked about the inferior border, right? And this is the antero-inferior angle, which is prolonged, right? Now, look over here. Along this line, which is a part of the inferior border, I'm telling you to focus only on this much part. All right? See, we have the parietal bone over here, the sphenoid bone over here, the temporal bone over here, and the frontal bone over here. So these four bones, that is the frontal bone in front, the greater wing of sphenoid below, and the squamous part of the temporal bone behind, and obviously the parietal bone's anterior-inferior angle over here. These four bones together, their meeting point is called the pterion. All right, pterion. So again, I'm repeating it very fast. The antero-inferior angle of the parietal bone articulating with the frontal bone in front, greater wing of sphenoid below, and the squamous part of the temporal bone behind. Together, these four bones, their meeting point is known as the pterion. Now, the pterion is having special surgical significance. Why is that so? That is because deep to the pterion, we have what we can call to be the stem of the lateral sulcus and middle meningeal vessels. Stem of lateral sulcus and middle meningeal vessels. These will be much more clearer when we will be talking about the neuroanatomy and the cerebral hemispheres, and how the lobes, that is the different lobes of the brain, they are separated from each other with different sulci and different gyri. All right, I hope that is what the pronunciation is. Anyways, so the pterion, deep to that lies the stem of the lateral sulcus and middle meningeal vessels, right? All right, done. Now this over here, this is the posterior-inferior angle. So we have kind of talked about all the angles over here, right? This one over here forming the lambda, this one over here forming the pterion, that one over there forming the bregma. So now the only angle that remains is this, that is the posterior inferior angle. Now you see the posterior inferior angle, what is it articulated with? This part, this bone. What bone is this? This is the temporal bone. And this bone over here, that is the occipital bone. But we need to be a little bit more precise, right? So when precision is concerned, we can say that this part of the temporal bone, what is this part? This is something that I've already discussed about. Yes, that is what we call to be the mastoid part of the temporal bone. So the mastoid part of the temporal bone, and what is this? The squamous part of the occipital bone. Mastoid part of the temporal bone, squamous part of the occipital bone, articulating with the posterior inferior angle of the parietal bone together. Their meeting point over here, very beautifully demarcated. This is known as asterion. Quite a beautiful name as well. The asterion is also important because, do you remember what special vascular structure I had talked about when I was talking about the inner aspect of the posterior inferior angle? When we were talking about the inner aspect of the parietal bone, we talked about a groove on the inner aspect of the posterior inferior angle that lodged the sigmoid sinus. So the asterion is actually overlying the sigmoid sinus. So that completes all the angles, that completes all the borders, that completes all the surfaces, that completes all the articulations. And I feel like that also completes the parietal bone. So this was an easy bone, and I hope I was able to be as clear as possible with all the informations and facts. There was not much information regarding this bone or facts to discuss, but that was it. Thanks a lot. Thank you.